The majority of people in Papua New Guinea live in rural areas, many in remote locations which have no services. Nazarene Health Ministries Rural Health Services has 4 rural facilities. 2 of them, Bana and Dusun, need power for emergency lights and vaccine refrigerators. Bana is the newest clinic for Nazarene Health Ministries, established just last year. Bana is in the very remote Isipik province. The nearest town is over 5 hours away by a difficult and dangerous road. It is the only functional medical care for a long ways in every direction. This new clinic is already seeing 15,000 patients per year with only 1 nurse. Our nursing officer, Buckley, was joined this month by his wife, Charity, who is also a nursing officer, and we hope to find a community health worker as well. As Bana is off the grid, Rural Health Services is flying in a new solar system to help meet the demands of this growing ministry. Buckley and Charity are graduates of our own nursing college at Kujab. They are really your Nazarene missionaries in this area, which is very far from their own home tribes. They are living in an area with a different local language, culture, and customs, trying to bring the love of God through healthcare. Dusun also is in a remote mountain range of the Madang province. The Church of Nazarene has had extensive church work here over the last 50 years. Recently, Rural Health Services has made Dusun an extension clinic of our Sangapi Health Center, which is over a 10-hour walk away in the high mountains. Both Dusun and Sangapi are only accessible by plane or several days of walking from the nearest roads. This extension clinic and the solar power systems we will install will give basic health care and immunizations to the estimated patient population of 8,000 people. One of our community health workers, Joel, will be based there in his home area. He is also a trainer for community-based health care. CBHC, or Community-Based Healthcare, is another division of Nazarene Health Ministries, which works in these remote areas to provide holistic community transformation. CBHC helps communities work together to find local solutions for healthy living in all aspects of life, social, economical, spiritual, and physical. It is a great way to bring about real change in the lives of people in these remote places and a great platform for discipleship. When we send in teams to install the solar power, we will also send CBHC to continue to work with pastors on our most important healthcare knowledge, as well as training healthcare workers and community health volunteers within the communities, and talking to communities about holistic health changes such as basic sanitation, pregnancy care, clean water, volunteerism, and spiritual transformation. Not only at Dusun and Bana, but we will use these trips to extend even further into the most remote areas that don't have any health care at all. Today you have an opportunity to help us pay for the costs associated with both getting this life-saving solar power to these remote areas and also to extend community-based health care into the most remote places beyond. All of this is to help people hear and understand the good news of salvation in Christ. We appreciate your prayers and your support.